Well, like every other state in the country, Florida very concerned about the health of its residents, high rates of heart disease and cancer and obesity. And in many of these cases, these diseases can be prevented or at least minimized, and healthcare organizations are becoming more and more proactive. BayCare is one healthcare system that's been taking the lead in a more preventive approach from sick care to well care. And joining us today is Steve Mason, President and CEO of BayCare Health System. Good to have you here.
Great to be here. Thanks.
So talk to me about these. I've been hearing this term a lot, sick care to well care. What do those terms mean to you?
It really is a concept of health versus health care. Much of what we do in our hospital work are take care of people that need health care, people that are sick. The whole concept around where healthcare reform is moving to population health is all about health of the community. And what we focus on at BayCare is that whole concept of health. In fact, our mission starts out that we'll be here to serve and preserve the health of the people that we serve. So we've always focused on being involved in providing services to the whole community. Good example is we have 11 hospitals, but 273 access points. Those are all community-based. Mm-hmm. We have 220 primary care physicians' offices, lab draw sites, all within close proximity to where people live. That's really to set the stage for how do we help people become healthier, and health really relates to early detection, prevention, and trying to make sure that people understand that their lifestyle, what they eat, how they exercise, and how often they go see the doctor has a great deal to do with keeping them healthy and keeping their quality of life up.
You know, as far as public perception is concerned, I mean, when people hear the term hospital, they think of a place that people go when they're sick to get fixed, to get treated, to get better. So you're really kind of rebranding your whole image. Don't want to put hospitals out of business because you're now changing your whole tone to let's prevent some of these things from people from coming through our doors in the first place. Right?
Exactly. There will always be a need for hospitals, unfortunately,
because
people will get sick. But I like to say we're moving our front door from just not at the hospital, but to the physician's office, because it's at the onset of illness where we go to find a physician. Very few people that become ill end up in the emergency room. Many more end up in the physician's office. And if you're going to look at the first step of improving health, that's where you need to start. Where you have the diagnosis of the patient that perhaps can be kept from the patient becoming more sick, that would need hospitalization, and then begin to look at where we might have caught something early, how the patient can change their lifestyle or medication, or even some minor surgery perhaps that wouldn't be done in the hospital that could keep that patient much more involved in the community and have a much better quality of life.
Now, Steve, you came to BayCare in 2004. What appealed to you about the Florida healthcare scene? Why come here?
I think there were two things. I came out of the Dallas-Fort Worth marketplace, which is a very big marketplace. The first thing that I recognized is that in the Tampa Bay area, there is much more community cohesion. You know, we have at the local politic area, we have local kinds of issues. But when you get to the bigger issues around healthcare, around economic development, the communities are much more active at working together. And BayCare itself is a tremendous organization. We have over 20,000 people, as I said, over 270 access points in the marketplace. And through our mission to improve health, it was a natural for me because that's what I've focused most of my career on, large healthcare systems and working to try to improve people's health rather than focus only on sick care.
So from a patient's perspective, what are some of the things that they can see to sort of drive this point home that you can be an advocate for your own care? You can be more proactive in taking care of yourself and preventing obesity, type 2 diabetes, some types of cancers, heart disease, and things like that. I know you have some early detection things that you're doing for the hospital. Give me some of those things.
A good example is anybody that's been driving around in the market will see 7 minutes can save your life.
Yeah, tell me about that.
And that's really about early detection. We have an opportunity for people to go on and do risk assessments in 13 different areas that begins to look at weight, age, family history, to give you some sense of where you might have challenges that you might want to look into. And the sooner we look into potential issues, the greater the opportunity of keeping things from getting worse or even reversing things that are beginning to happen to us physiologically.
And that's on a website, isn't it? You have
It's on a website.
People can log on?
Our focus is, and you'll see a lot more of that in the Tampa Bay area, we are looking at how can we work towards getting the community better information and information at their fingertips so that they'll be able to ask questions, find a doctor, be much more involved in their health.
And tell me about the medical home. So that where people can all come together and...
We have a clinically integrated network that has over 800 physicians in it and probably about 300 primary care physicians. And our goal is for the primary care physicians to be working off of a certified patient medical home. And the medical home concept is one in which the physician begins to work with the patient, begins to look at the risk screening activities, and if people are potential candidates for type 2 diabetes, begin an earlier process of monitoring the patient. More contact from healthcare professionals, nurses, and other therapists that are familiar with the kinds of problems that the patients might have that may be contacting them by letter and by phone, inviting people to educational classes to learn more about that, parents to learn more about the health of their kids, so that we can all start getting more involved in understanding what's going on in our family's health and focusing on a longer, more uninterrupted quality of life.
And Steve, you said one of the things that appealed to you about the Tampa Bay area was that there was a sense of community involvement. How do these partnerships work in terms of the message you're trying to get across about preventative care?
I think there's a great partnership in health in the marketplace. There's certainly involvement from a number of hospital systems in health activities and research. And at the community level, we're all beginning to communicate more effectively and work together to bring the messages out about how do we improve health and about being able to share electronic medical record information so that if an individual that sees ordinarily sees a physician that works at one hospital, if they end up in an emergency room in another hospital, they can get access to the basic kind of information that may help the treatment of the patient, may help keep the patient from being admitted and have some other level of care.
And you were a big part of making sure those electronic medical records came to BayCare and were up and running, and how's that changed the whole system for you?
It's really amazing. We were on a journey. We had a project called Beacon that was so big it had to have its own name. It's been about 6.5 years. We're almost completely finished with the project. And in our hospitals, we're about as electronic as we envisioned we would be at this point in time. What it really has done is that it has given us an insight into information that we didn't have before, because now we have data that helps us go through and look at, regardless of patient's name, look at hospital conditions. So we could look at all of the sepsis patients, for example, in our hospitals and begin to understand what treatment by which physicians are working better for those patients. When all the documentation were in paper charts that had to be mined by human beings, one data point at a time, you didn't have the insight that we have now, where we can send out a message to capture certain data points and have them interact with each other from an electronic point of view. And we're learning things that, frankly, we didn't know that we didn't know.
Right. And I'm sure
so it's
in
really
terms
exciting.
of infection rates in hospitals, such a huge issue could be a huge advantage there. And also people who've gone to different hospitals or different doctors, and they could be on competing medications, or you now have a sense of where everybody is because of the electronic records.
The point you bring up is safety. It really has improved safety because we have the opportunity to catch drug interaction problems that we might not have seen before.
Absolutely.
Because they're all working within that same electronic space, where with paper charts that may be miles apart from each other, you can't capture that kind of information.
And just on the screen, had a graphic up there talking about how big the medical community is here in this area. 11,000 doctors, 58,000 registered nurses, 50 hospitals in our Tampa Bay region, and we have one of 9 medical schools in the state. So we have a huge community here in terms of the medical community working together to try to help the health care of the state of Florida, which I know you're very concerned about our residents.
It is a huge community, and it represents a significant economic driver for our community as well. There's some 80,000 people that just work in hospitals, and probably to a factor of 4, all of those that are involved in some form of health care. It's one of those basic industries, and it's a growth industry. We've been seeing, we all unfortunately are getting older, and the baby boomers, when they get past 65, is where you'll have your greatest health care expenses.
Huge mushrooming population.
So we begin to see that this is a community that's prepared because of the research and the services that are available within the marketplace. And the community need to be very proud of the healthcare industry here.
I want to continue this conversation and bring out a gentleman I know you're very familiar with. Dave Pizzo, President and CEO of Florida Blue, is joining us. Why don't you go,
Sure.
Mr. Mason, just scoot right over there. And David Pizzo coming out. Hope he's coming out. Hey there. Welcome. How are you?
Great. Good
Good
morning.
to see you. Good morning.
Good to
Welcome
see you
to
too,
Front Row
Kathy.
Tampa Bay.
Thank you for having me
Have
today.
a seat. And this is going to be a great conversation because the two of you are working together on something that is a great initiative called One Bay Healthy Communities. And you are the vice chair of it. And so what's really kind of interesting to me is here we have the head of BayCare at the hospital, got the guy from the insurance industry. How in the world did you two come together to work on a project like this? Tell me.
When, the beginning of One Bay Healthy Communities really started with a very simple but powerful question. How can we be the healthiest region in the country? The 8 counties of the Tampa Bay Partnership were beginning to look at how to focus on health. And with the Tampa Bay Partnership's ability to use the blueprint for prosperity and its focus on health and education through that, we began to look at how do you create a sustainable, engageable, and involved kind of focus on health.
So Dave, you took this survey, asked all, just to find out what the health of Florida was and our residents in Tampa Bay area residents compared to national statistics. What did you expect to find? What did you find?
Well, that was actually a very unique survey. It was probably one of the more challenging things that we did, but that was the first part of this project, to analyze the data for the 8-county region. And we produced a very good report. We had terrific partners, including USF, that helped analyze the data. We have some challenges and opportunities here in Tampa Bay, but what it did, it gave us focus and areas that we can move forward on. We know where we are, and now there's an initiative to really focus on things to improve.
I read a quote from you, Mr. Pizzo, and it said, on the whole, we're about average, with deaths due to heart disease, stroke, and cancer declining, but alarmingly high rates of obesity and diabetes. And your quote was, average is not good enough.
That's correct.
So the big concern here, obesity found 33% of children, ranking 35th, Florida ranking 35th in the country, and overall adults 65% obesity and overweight. That's 29th in the country. So this is alarming. This is something that you felt like we need to get a handle on this.
Absolutely. It's one of the areas that we've developed guiding principles, and one of the guiding principles will help steer us in certain directions. That's going to be one of the areas of focus. Chronic disease prevention, and obesity is at the cause of so many different chronic diseases that could either be prevented or minimized.
And then also with the type 2 diabetes, heart disease, certain cancers, this obesity epidemic is something that nationally people are very, very concerned about. So what alarmed you about that?
Just that we know the cause and effect, and high rates have a higher rate incidence of those diseases, and we can do something about it. And that's what this initiative is all about, One Bay Healthy Communities. And we know if we get the community and the various stakeholders rallied around improving, that we could make a difference. And in fact, we've started to do that this year through one of the major initiatives, which was the Walk to the Moon Challenge.
Mm-hmm. We're going to mention that in a minute. I want to know how these two industries have come together to try to manage what is going on in people's health care, especially preventable things that are preventable through lifestyle changes. So I know there's a website that you have where people can go on to get information. I looked at your website. It was fabulous. I mean, they had great information on this website, things about drugs that can help fight alcoholism, how to look at your family history for foretelling early heart disease, depression that is felt by people whose partners suffer heart disease. I mean, this is great consumer information, and this all came out of this survey.
It did, and to your question, how we can work together, we're moving towards managing the health of a population rather than this fee-for-service world that we're in. So all of us, the payers, the providers, us as consumers, all of us have the need to begin to look at how do we focus on the key issues of the community. And fortunate for us, we have in our 8 counties, we have some very superb health departments. We have community activities that are beginning to focus on childhood obesity. So from a partnership point of view, we saw the opportunity to bring stakeholders together and talk about how can we, working together, be able to create the change and engage all of these communities to raise one voice. We have to have a louder voice around obesity in this community. And with all the stakeholders we found through One Bay Healthy Communities, we found a vehicle to be able to do that.
And I think one of the big national trends is that when you were doing this survey, so many of these employers, I think 75% of the employers that took part in your survey believe they have a responsibility for taking an active role in their employees' health. Many of them have on-site gyms. They discount health club memberships. Many of the hospitals are now prohibiting smoking. You know, tell me how employers have responded to what you're trying to do with them.
Yeah, I think that's one of the most exciting things happening in our industry. Certainly more and more people are taking accountability for their health, but we're seeing more and more employers and management at employer companies really getting engaged. And there are so many creative programs out there, whether you're a large company like a BayCare or even a small company like the Tampa Bay Partnership. But there are so many different things people can do to incentivize good health.
Like, what are you seeing companies do? Tell me some of the creative things.
Well, some of the things that they're doing, first they set up a wellness committee, kind of a cross-functional wellness committee to look at the data on their employee base and to see kind of, like we did for the region, they're looking at their company, how healthy are they? And then they decide, what areas should we focus on? They may look at stress in the workplace or smoking rates or maybe even obesity or things like that. And they decide, what do we want to improve as a company? And then put programs in place. Many companies have put walking type programs. You mentioned a few, incentives for the gym, things like that. But some of the real creative incentives have to do with lower premiums for employees, things like that.
Lower premiums if they
follow certain
guidelines or make some benchmarks
Exactly.
or something.
I can give you examples. In our program, we have gone completely smoke-free on our campuses, and for families that have no smokers or tobacco users in their family, we reduce their annual or their monthly benefit payment. Same for single team members. And then we started an initiative called the Ultimate Loser around our organization, and I was amazed with 2 sessions and about 3,000 team members involved in the process. We lost 12,500 pounds.
What?
Mostly walking.
Just
so
walking?
Just walking. It's amazing when you think about it. That's the size of an unloaded school bus.
Wow.
So we now have set the goal on a small Learjet. So we're,
I think that sometimes, you're talking about getting people involved and taking a more active role in their own health and preventing things. And it doesn't have to be spandex in the gym, on a treadmill. It can be walking your neighborhood, just simple lifestyle things you just have to impart that people get that I can make a difference.
the exciting thing is that you see people react to it. You offer opportunities, and I'm amazed at how many team members will get involved and then send notes. The stories that we get back are really rewarding about how they feel like their lives have changed because they lost 20 or 30 pounds. And I think people want to get involved. They know they want to be more involved. It's how do I find that avenue, and then where are the opportunities and socialization with peers in doing that kind of an exercise is really a great thing.
Well, if your employer makes it okay to do and makes it possible and adds advantages and incentives, gives you a gym, has a walking program, I mean, they're saying, my boss is saying this is good for me, then I'm going to be able to participate better.
The Walk to the Moon, 80 employers, nearly 6,000 people walked to the moon and back in 7 weeks.
Tell me about this Walk to the Moon challenge. What happened?
Yeah, that was one of the tactics we put in place. After we developed the report, we convened a forum looking at the health of Tampa Bay. But one of the things we used to activate and energize the community was this Walk to the Moon challenge. And it's about 250,000 miles to the moon. We challenged the
It is.
people.
It's 250,000 miles if you were to walk to the moon.
That's right, 250,000 miles, amazing. But we challenged the community, and we had, like Steve said, so many participants, over 6,000 people walked, and about 80 companies or organizations that participated. And it created a lot of excitement, a lot of challenges. There were a little bit of competition between groups. And I think overall we walked about 76,000 miles.
I have the numbers right here for you. The walkers, 6,000 people from 70 companies walked 375,000 miles, actually walked further than if they walked to the moon, which is a mere 857,000 miles. So they actually surpassed the Walk to the Moon by doing this.
They walked halfway back, and next year we're going to have another challenge in the spring, and we're going to have a Walk to the Moon and back. But that was a good rallying cry for the community. One thing we asked people to do was, even if you exercised or walked, to increase that amount, say 3 days a week by 20 minutes. And that was the encouragement. It didn't matter if you walked or rode a bike. There were calculators to convert everything to miles that would actually go onto a website and make it very easy to track. And we had, again, a lot of friendly competition. But it started to create a little bit of a culture of health. And we think it was the beginning of a movement. And that's what happens in companies. There's a buzz, the management gets involved, employees, it's fun, there's incentives, and that really starts to grow. And we hope that that is really what's going to happen in Tampa Bay.
And a huge benefit, I would think, this community outreach program that the two of you together and others have put together, a huge benefit to the business community in Tampa Bay, wouldn't you say? Seeing a lot of that. Thank you very much. Really appreciate both of you being here today, Dave Pizzo and Steve Mason. And thank you for making us all healthier here in Tampa Bay. Good to have you here.
Great, thank you.
Coming up next, the bold ones, the ones who take a leap of faith to build their business from the ground up.